My name is Dr. An, and Ms. Lewis, you want to introduce yourself?
Sure, I'm Lois Williams.
And how did you come about coming to our clinic?
Well, I have, my husband passed 10 years ago, so I have been on my own as far as medical stuff. So when I heard about stem cell, I really started researching it and thinking, I'm getting old, this might be something I need to know. And then I have a friend there in Oklahoma who he went with me to different seminars and different outlets that we had to try to get familiar with it. And so when I saw this, I thought, let me give it a call. Just let me give it a call. And luckily, he was down here that weekend, so he made sure he brought me to the appointment. He came and he sat right there, real quiet, real patient.
Yeah, I saw that. Yeah.
Because that was something we had dreamed about and thought about. And yes, I'm really excited with it.
And what were you exactly looking to get treated when you found us?
Well, I had been, my eye had really gone bad to the point where it looked like I was going to become blind.
Oh, no.
And I was looking at that, but the stem cell in that area wasn't really that familiar to what I was looking for.
Mm-hmm.
So, but I thought, well, let's see what this is. And then my doctor, foot doctor had been talking to me about neuropathy.
Uh-huh.
So when that advertised for that, I thought, well, let me go try that. Let me see, and then that way I can see if the stem cell is really what I'm thinking it is.
Okay.
So I didn't realize when I came in how bad my poor feet and my poor legs were,
Right.
because I had been shopping like a couple of days before, grocery shopping, got in my car, got on packages and got in my car, started to go home, and all of a sudden I couldn't get my foot onto the brake. I couldn't.
Wow.
I tried and tried. It wouldn't get onto the, I couldn't move it.
Wow.
So what did I do? I looked around real quick. I didn't want to hit anyone.
Mm-hmm.
So I hit this big old light pole instead to stop me.
Oh, wow.
And I sat there for the longest time thinking about what's going on.
So you actually lost the control of your foot due to this neuropathy, and you ended up hitting a light pole. It actually caused an accident.
One of those big ones in the
Oh,
center
wow.
of the parking lot, with the concrete all around.
yeah.
Yeah, I got my scar out there on my car still. I could show you.
Yeah, I'm so glad that it didn't hurt you so badly. But
Or
that,
hit someone.
Yeah.
That was what I was scared of.
yeah, and that's what motivated you to come see if there's
that's
anything that can be done about it for your foot pain.
Scared,
Yeah.
scared.
So, what did your feet feel like? I know you couldn't really control it very well, but did you have any numbness, pain? What did they feel like?
You really want to know?
Yeah.
It was like I was carrying around 2 concrete bricks
Oh, wow.
for my feet.
Wow.
And sometimes they would go, and sometimes they would turn sideways and knock me down. And once I
Wow.
get down, I couldn't, still have a little bit of hard time getting up.
Wow.
But it would go from my leg, calf muscle, down to my feet.
And how long did you feel that way?
Before I came,
Mm-hmm.
probably about a couple of months.
Couple of months, okay.
Not
And-
to that point of
not-
not being able to get my foot on the brake, but feeling that pain of, at night, the feet just feel like they're just bricks laying there,
So you had the feet issues before, but the last couple of months it just really gotten really bad.
Right.
Did I see that? I think you also shared us that you're very diabetic, right?
Oh, yes.
Do you wanna-
44 years worth. I got diabetes when I was pregnant with my daughter.
Oh, my
I've been
goodness.
fighting that little beast all this time, but I'm determined, so.
Yeah.
And sometimes it goes up, sometimes it goes down, but.
I think when you came to us, you were taking Trulicity, the diabetic medicine,
That's right.
and even with the Trulicity, your morning glucose was well above 300s, right?
Mm-hmm.
How's that been so far since you started care with us?
Well, when I started here, it dropped real quick down to 200.
Okay.
And then when I got down to the hundreds, I was just dancing everywhere, So I already stayed to a diabetic kind of diet. So
Okay.
the little diet in the booklet, that was really good, and those were little supplements that were helping me.
Yeah.
But I could really tell a big difference in how I feel.
Yeah.
That
Yeah.
once you get that, then I'm not got that head that I feel like I'm going to fall or scared I'm going to fall.
Gotcha.
Gave me a little bit more security.
Yeah, I'm really glad to hear that. So your diabetes has been greatly improved.
Greatly. I got down into the 90s, and I had
That's
a 70
amazing.
the other day. So I don't get all excited because then something will happen and I'll go back up a little bit. But it's just like my weight.
Okay.
When I came, I'd already been kind of watching what I ate, but I didn't expect. So when I set my goal, I thought, I'll just set this goal, make them happy.
I remember you thought that eating fruit was something healthy to do, right? And you
Oh,
had
yes.
quite a bit of fruit intake throughout the
And
day.
coming down here to Houston, and you've got all of this fabulous fruit. Oh my gracious, yes. Well, I'm not going to lie. I do have some fruit during the day, but
Okay.
not what I used to.
Used
eat.
to,
Yeah,
right,
yeah, yeah.
right. So fruit glucose have rather damaging effect for patients who are diabetic, and she did not know. And unfortunately, and I don't know why, her doctor wasn't also bringing that to her attention either. So she had greatly reduced her fruit intake and taking a high quality supplement to help improve the diabetes. And in turn, everything that's we've done has also improved your feet issue as well.
Sure.
Yeah, yeah. Can you just briefly share how you were feeling, like things that you couldn't do before, but now you're able to do certain things? I know that you went to a nutcracker market earlier this week and was able to walk around. Can you talk about that?
Right, and I've even started doing a little grocery shopping, which I could not do before because
Wow.
I'm scared. I'm
Yeah.
scared. I'm going to get in the middle of the grocery store and fall. I'm not going to have a
Yeah.
buggy to hold on to,
Yeah.
you know? It's that feeling of insecurity. So now I'm getting that back. So I go out a little bit more. I'm doing a little bit more. When those limbs are falling with all this wind, I'm out there. I pick up those limbs. Not my daughter, it's me.
Oh, that's great.
And so the kids in the neighborhood come and help me break up those limbs and get them in the trash. So, you know, a little candy here or there really helps, you know.
I think you should continue to ask them to do that for you.
But they're not used to seeing me outside doing it.
Oh, that's
for work,
fantastic.
see?
Yeah, yeah, that is fantastic.
Yeah.
Do you have anything else to share about what your experience has been, how our staff's been treating you when you come to the clinic for treatment?
Yes, but what I'd like to say was last weekend, weekend before last, my friend from Oklahoma, he came down because of my little granddaughter's performance, and he was so surprised. He was the one that came in with me.
Yeah, I remember.
He was so surprised because he drove me, and I would just bounce out of the car and be okay. No, you don't have to curb park me. I can do it, you know.
Yeah.
He was really amazed. And then he also mentioned that how I didn't have to run over here and look for a little ramp to walk up. I just can step my feet up and go. So I just wanted to tell you that's experience from someone that saw what has happened.
Yeah. So he knows you before how
And
you
he knew at
were,
the point I
and
was,
now
yeah.
he sees you how good you are now.
Yeah, and energetic. Yeah.
Well, I'm so glad to hear that, and thank you so much for coming down and sharing your experience with us. And it means the world to all of us here that you've had a great success and now you're able to walk around and do things. It just means the world to us.
And everyone here is so professional, and they make sure, you know, I don't have to wait. They're ready for me when I get here. So that really means a lot. So even if it's where I don't like needles, but I do the needles, I don't complain. Because, you know, they're professional. They can do it. They don't leave a big old scar or a big old bruise all over me, you know.
All right. Thank you very much, Miss Lewis.